Now we have stops part 2. So like we mentioned before in the Mackenzie's derangement group, which informed this group in the stops trial, it is known as reducible discogenic pain, which means discogenic pain that responds positively to mechanical loading strategy. Discogenic pain have at least 4 out of the 9 following characteristics. It's pretty long, please excuse me for using my script.
Presence of low back pain with or without leg pain. Sitting limited to less than 60 minutes. Symptoms worse the next morning, worse than the initial injury. History of working a job that involves manual handling. A mechanism of injury associated with bending forward, rotating, or compressive loading. At least some difficulty with forward bending. At least some difficulty with lifting. At least some difficulty with going from sitting to standing. And at least some difficulty with coughing and sneezing.
A positive mechanical loading response will look like, and excuse me for having my script again, this one's quite long again.
Increased range of motion of the spine. Increased observed intervertebral movement. Improved resting pain by at least 1 and lasting at least 1 minute. How's your pain, Will? It's much better. Reduction of lateral shift postural abnormality and centralizing of pain. Is your leg pain still there? No, it almost feels like it's all gone back into my back.
Once again, we'll start off with session 1. This is how session 1 is going to look like. We're going to educate the patient around reducible discogenic pain.
So you have a disc that's protruding and it will take about 6 weeks for it to heal.
Use this to manage any inflammation.
Then we're going to provide some postural advice as well as provide some mechanical loading strategy.
You're going to do some gentle forward bending to the point of pain, 1 set of 8 for every 2 hours.
Put this behind your back, like you put for long periods of time, and just be careful of the spine.
Here's how session 2 to 10 will look like. First, check up on the patient to see how they've been from then to now.
How's the morning pain going? It's still there, but it's lessened. Have you been doing the exercise that I gave you? Yes. And how's work? Work has been good. I've not been stressing my spine as much.
Then we're going to provide more advice and education, as well as progress the mechanical loading strategies that we prescribed last session.
Well, keep doing what you're doing. Things are looking great, and things are positively changing.
And instead of doing 1 set of 8 every 2 hours, do 1 set of 15 every 2 hours.
If the mechanical loading strategy is not working, we would then move on to specific motor retraining. And due to your short attention spans, again, the exact protocols will be put up on the screen when I'm editing the video. Keep in mind to watch the patient's symptoms very closely, make sure that he's okay, and also to push the patient to the point of pain. Do not push them past their point of pain. Keep in mind, this one is quite a niche subgroup of patients. That's why these treatments can achieve great effects. It's like in anime, the greater the sacrifice, the greater the power. And that's it. Part 2 of stops has been summarized.